I have murdered more people than Ted Bundy.
Throughout history, whenever great injustices existed, youth movements have risen up to combat and end those injustices.
You have organizations out there like the Center for Bioethical Reform,
the Center for Bioethical Reform,
Canadian Center for Bioethical Reform,
organizations like the Center for Bioethical Reform to receive public funds when they then use to attack a woman's right to choose.
Abortion kills all kinds of people, so then all kinds of people can join the pro-life movement to save these babies.
I was talking to a young man on the streets of Toronto.
I spoke with a woman named Lucy about abortion.
Today we were doing choice chain in downtown Regina.
By the end of the conversation, she was completely pro-life.
He then walked away 100% pro-life.
Completely pro-life.
We should remember that each of those babies that die every day in Canada not only have the right to life that's being violated, they also have the right to our defense.
Hello, everyone, and welcome back to the Pro-Life Guys podcast. Thank you so much for tuning in once again. That opening quote probably startled you, and for good reason. I have murdered more people than Ted Bundy. That is a quote from our guest today, Dr. Kathi Aultman, who is a former abortion provider, no longer is anymore, currently working in the pro-life movement, speaking out against the abortion industry and against abortion itself. And we will be having a conversation with her today. But before we get into that, my name is Peter. I am the host of the show, and I am joined once again by my wonderful co-host, Cameron Cote. Hello, sir. How are you?
I am doing very well, Peter. We're back doing activism in Calgary, which is a wonderful, wonderful thing. It is getting cold, but we're out this past weekend, and I think all four of the volunteers having conversations. We're in conversation for almost the entire time. We've got 5 or 6 testimonies that'll be going up on social media soon. So I'm doing well. I'm glad to be back doing pro-life outreach. And I'm glad to be back in the studio with you for this episode with Dr. Aultman.
Yeah, likewise. For those of you who are unaware of who we are, or maybe this is your first time listening to the podcast, we are 2 guys who are passionate about ending the killing of preborn children in Canada. And this podcast, we started it to give you the tools that you need to change minds and save lives from abortion. We spend time on the streets, as Cam mentioned, and we want to equip you to spend time having conversations with others about abortion as well. And not just any conversation. We want you to have winsome conversations and effective conversations, conversations where you can actually see people change their minds. And one of the goals on the podcast is to meet people who have experience and expertise that we don't have, to learn from them. And that's what we're doing today with the conversation with Dr. Kathi Aultman. Dr. Aultman is currently an associate scholar with the Charlotte Logier Institute and a member of the American Association of Pro-Life Obstetricians and Gynecologists, the Christian Medical and Dental Associations, the Florida Medical Association, and is a life fellow of the American College of Obstetricians and Gynecologists. She retired from medicine after working as a board-certified OBGYN from 1981 to 2014. Early in her career, Dr. Aultman served as the medical director for Planned Parenthood of Jacksonville, Florida. Her experiences performing abortions eventually led her to become a staunch defender of life in the womb, and that's something we'll be talking about today. She has testified extensively on a variety of pro-life issues before state and congressional bodies and in state courts, and was featured. She was a featured speaker at the 2019 March for Life rally in Washington, D.C. Before we get into the conversation, I just want to share, this is a tough conversation. It's a hard conversation on a hard topic. She's going to be sharing her experiences, and she is going to be sharing the abortion procedures themselves, the way that preborn children lose their lives at the hands of abortionists. So I want you to know that as we go into this conversation, it's going to be difficult, it's going to be challenging, and yet as difficult and challenging as it will be, it is extremely important for us to know what these abortion procedures are when we're in conversations with people, know how to respond to them, know what's actually going on, and it's important to hear the testimony of someone who was on the other end, who performed abortions for some time. So With all that, we start the conversation with Dr. Kathi Aultman. We hope you enjoy it. Dr. Aultman, thank you so much for taking the time and joining us on the Pro-Life Guys podcast.
Hey, this is really exciting, being able to do this.
Yeah, we're really excited to have you on. We've looked forward to this for a while. Now, to kick things off, to start things off, could you give us a little background on how you ended up in the medical field?
Oh, boy.
A
When
big
I
question
was
there. Holy moly.
probably in grammar school, when I was in grammar school, I went fishing with my dad, and I wanted to clean the fish because I wanted to see their insides. And and so he had a great deal. I always cleaned his fish for him. And one time my mother brought home a heart, and I cut it open so I could see the valves working. And then I visited my aunt, who was the first female bioengineer, and I was so excited being in her lab. I just decided I wanted to be a scientist.
Very cool. I think of my own journey. So I've got a background in developmental biology, the number of different organisms I've dissected. I can definitely appreciate that fascination with how living organisms kind of fit together, how they work, that kind of thing. And I find that so interesting. And so as you were kind of going through your secondary school, getting closer to medical school, did you have a particular direction? You mentioned research. Was this something that you had a very definitive path that you were looking to pursue, or as you got closer to medical school, how did you start deciding what specialties or focuses you wanted to pursue, I guess?
Well, I spent a couple summers with my aunt, and the first summer I just did basic research with her, and this was when I was in college. And then the second summer, she put me in a program at Roswell Park, which is a cancer institute, and it was for people interested in medical school. And I realized that I liked interacting with people, and I decided that I wanted to help people, and that's why I decided I wanted to go into medicine. Now, also at that time, there were a lot of PhDs out of work. I originally wanted to be a marine biologist, but I wanted to be able to take care of myself because I had no safety net, and I wanted to know that I would be okay. And so I decided I'd apply to medical school first, and if I got in, I'd do that. I'd apply to graduate school second, just in case.
Safe bet there. Safe bet there. I think of when I was doing my directed studies and some of the extra research I did during my post secondary degree. Many of the people working in the laboratories had similar situations where they had initially hoped to be tracking wolverines through the Canadian Rockies and whatnot, and realized that there really aren't that many jobs for that in Canada, and so they needed to have a fallback plan, as it were, and yeah, see what opportunities really opened up for them, I guess. And so you're a bright-eyed student jumping into medical school, that sort of thing. Can you share with us a little bit about the journey from there towards, I suppose, becoming an abortion provider? What was that journey like, going from this was one of two options, and then kind of getting closer and closer towards working in an abortion facility, performing abortions, I guess?
Yeah. Well, it, it goes back to um, the summer before I went to medical school. I was already accepted. I met my future husband, and before we married, we had sex. And the very first time we had sex, I got pregnant. And I was afraid that one, everybody would think I was terrible. I was afraid if I kept the baby, uh, we would end up getting divorced, because that's what happens if you're forced to get married because you have a baby. And then I was afraid that I wouldn't be able to go to medical school and realize my dream. So I had an abortion. And I think that colored my my views after that. And so when I went to medical school, I bought into the whole pro-choice thing, and then I did a rotation in OBGYN and decided I really liked OBGYN. And while I was there, I saw some 12-year-olds giving birth, and I decided, oh my gosh, nobody should have to go through that at 12, So, and I became very pro-abortion, not just pro-choice, pro-abortion. And I decided that that was a way that I could help women. Most people don't realize that every OBGYN in their training, unless they opt out for conscience, has to learn how to do abortions. And there were some guys in my program who did opt out, but I didn't. I thought it was a good thing. So I didn't even consider opting out. Now, 85% of OBs do not do abortions, but almost all of them did during their training. And most people don't realize that. I not only learned how to do first trimester abortions, but there was a man who was an attending with our residency program, and he did late term abortions. And as a matter of fact, it just so happened he was the same guy who had done my abortion. So I knew him. And I went and I asked him, could I do a preceptorship with him and learn how to do D&E or dismemberment abortions? And he agreed, and I did them. And have you seen the movie Unplanned?
Yes.
Okay.
Yep.
You know how the heroine, okay, remind me of her name. It's
Abby Johnson.
Abby.
Yeah.
Okay. Do you remember how when Abby was told to go in and help in the cleanup room to count the body parts, and her reaction was almost the same as mine? We weren't horrified by what we saw. We were intrigued. We were fascinated by how beautiful the little bodies were, and the little fingers and toes and the organs. And we just thought it was really cool. And I guess that's not the normal response, but it was our response. And so we were doing our pathology rotation at the same time, and I would cut up specific parts that I wanted to see what the fetal tissue, the histology looked like, and send them on down, and was really excited to look under the microscope. I just did not make that connection that this is a human being I'm doing this to. I knew it was human, but somehow there was a disconnect. So during residency, most of the residents have to moonlight to make extra money because you don't make much money there. And I could either work in an ER or I could work doing abortions. Well, in the emergency room, I'd be seeing all kinds of different patients, and I wouldn't really know what I was doing. And I could make more money at the abortion clinic and do what I knew how to do, and do what I felt was helping women. So I decided to go to the abortion clinic and do abortions. Not only, now I even did abortions when I was pregnant. I got pregnant during the last year of my residency program, and I even did abortions then. And I thought it made total sense. My baby was wanted, so I was pregnant and I was keeping it. And their babies were not wanted, and so it was okay for me to kill their babies. I still saw no contradiction there. The only time that I did have some qualms about what I was doing was when I was on my neonatal intensive care unit rotation, and I realized that I was taking care of babies and trying to save babies in the unit that we were aborting, with the dismemberment abortions, late dismemberment abortions. But I kind of tucked it away. In medicine, you're taught to really compartmentalize things. And I think that's the way that we can do things that hurt people, knowing that it will help them. But just to be able to justify that in our minds, we have to compartmentalize, and it works works real well. So I continued to do abortions while I was pregnant, and it was only after I delivered and went back to the clinic that was when everything changed.
Wow, there's a lot there, and I'd love to talk about what it was that changed after you went back. But if I could jump back a little bit, you mentioned that your own abortion story was a significant factor in changing how you thought about abortion. What was what did those around you, your family, your friends, what did they think about your decision to pursue an abortion providing career? Were they supportive? Were they not supportive? And I asked that because from a little bit that we did research into your story and some of the other conversations that you've had with others, you have a Christian background. Your father was a minister. So what kind of response did you get from those around you when they learned that you were going to be providing abortions?
I never told them. I
Okay.
didn't tell them about my own abortion. I didn't talk to my family about, what I was doing in my training. I don't know that it ever came up. Now I have to say my mother is one of the original women's libbers, and she and I disagree. We sort of agree not to talk about it because she's very much in favor of abortion. So, but
Gotcha.
I wish at the time when I got pregnant and was considering my own abortion, I wish that I had talked to my mother, because I would have found out that she would have been supportive. My family would have been supported. My friends, they would have supported me. The three reasons why I chose to have the abortion ended up not being valid. I ended up divorced from my husband anyway. Um, I met in medical school women who had had their children first and then went to medical school. So it wasn't like I couldn't have gone on to medical school. And so all three reasons were invalid.
And was that the reason you didn't share it with them, because you weren't sure what your family was going to think? Is that why you decided not to tell anyone?
I was embarrassed. Well, okay, I didn't share about my abortion because I was embarrassed and I was afraid of what they would think. Yeah, exactly. And I think that's true for many, many women. As far as later when I was doing abortions, it just never really came up.
Dr. Altman, thank you so much for being willing to share this experience. I can only imagine what it's like to, in some ways, relive this experience. If I could ask a little bit about kind of getting involved, you mentioned this heart for the pregnant mothers who are coming in, seeing these 12-year-old girls very young. I'm sure very, very hard circumstances that they're faced with. And this is a theme that we've heard from people who are still performing abortions. I think of a couple of my colleagues have debated Dr. Fraser Fellows, who performs abortions in Canada. I think even of the testimony of Dr. Henry Morgentaler in Canada, who was in many ways a pioneer. And recurring theme has been that heart for these pregnant mothers coming in all sorts of different circumstances and whatnot. And I wonder, as somebody who was involved in the abortion industry, as it were, as a doctor, were you talking to these women and learning about what kind of circumstances were pushing them towards their abortion decisions, and this was a way for you to understand where they were coming from and then help them, I suppose, with abortion? Or maybe just unpack a little bit the circumstances that some of these abortion-minded women were coming in with, and how that may have impacted your decision to continue performing abortions. You mentioned that you were performing both early term and late term abortions, and that this was more a matter of wantedness or circumstances surrounding, rather than a particular level of development. Is that fair to say, that looking at the circumstances that many mothers were coming into the clinic with, you were seeking to help them, I suppose, is kind of what you were meaning?
Okay. So I assumed, okay, I wanted to do something good because I assumed that that was the best thing. But I have to tell you that when I was actually doing abortions, I don't think I ever did an abortion for a fetal anomaly or um, because of some tragic circumstance, except for one. And I do want to get back to why I stopped doing the abortions. Um, there was one case there that was a hard case, but um, when I was when I was actually doing the abortions, it was just mostly I would do their, be questioning them prior to the abortion because they back then they had to have a reason, and most of them did not have a reason other than they didn't want to be pregnant. And so I would have to say, well, won't this bother you psychologically, if you have this baby? Oh yeah, okay, psychological reason. um
Mm.
I don't think I had any that really um were really hard, tough stories, other than they didn't want to be pregnant. Now, the population where I was working was a college town, university town, and so these were mostly well-educated young women. But
Mm.
basically, it was they didn't want to be pregnant. After being in practice for over 30 years, what I found in my practice was that um, I think we hurt women more than we help them with abortion. I believe that whole line that pregnancy was the worst thing that could happen to an unplanned pregnancy was the worst thing that could happen to a young woman. And that's just not the case. It's really a small portion of time out of their life. They can always adopt the baby out. Now, that's gotten a bad rap. Women think, oh, I don't want to give my baby away. I won't know what happens to my baby. So it's better to kill them? Is that better,
Mm.
really? You know, we need to re-educate people on adoption. And I guess they have something called open adoption now, where you can have some interaction with the family that adopts your child, and even maybe choose the family. Um, that kind of stuff is great. So we need to make a we need to make adoption a better, more
Mm.
viable and better thought of option. But
Mhm.
I don't think any woman, and what I found in my practice, women cannot kill their child and remain unscathed. At some point, it comes back and bites them. And there's so many women who I saw that were depressed after their abortions. I had one woman who came in who, I think at 7 or 8 weeks, she found out she was pregnant. She said that she had a knee-jerk reaction. This is not good timing. She went and got an abortion. Afterwards, she was devastated, became suicidal, and had to see a therapist because what she said was the realization that she had killed her child was far worse than the um, trauma she felt of being having an unwanted pregnancy. I had another woman who was deeply scarred. This was a woman who had an abortion at 20 weeks. It was an induction abortion where they give medication to make the uterus contract and they go into labor. And she was finally, after having cramps all night, she was finally told to sit on the toilet and push the next morning. And she delivered a little baby boy into the toilet. And she subsequently had terrible psychological problems because she related to me that her brother had drowned, a little baby brother. I'm sorry. She related to me that her baby brother had drowned as a little baby or a toddler, I guess. And here she had drowned her little baby. She had come to me because she had continued bleeding for, I think it had been 6 months after the abortion, and I was trying to help her with that. But in the process, she related the story. So I guess what I saw in my practice was what I saw in my practice, and the thing that went against what I had believed was that I saw young women who kept their unplanned pregnancy, kept this unplanned baby, and did really, really well. and other women who had abortions who were really struggling emotionally, had physical complications. And so abortion is not the right knee-jerk reaction. We've really been sold a bill of goods that women can't, they can't meet their dreams and their goals unless they kill their children if they get pregnant. And that's so sick. And it's not what I saw in my practice.
Yeah, it is quite something, and we hear it all the time. Cam and I have been in the movement for some time, and that's one of the things we often hear, that for women's empowerment to actually be a thing, for women to be empowered in our society, abortion access is something that they must have. They must have this right to end the life of their young human being, and at the same time, we often hear stories of people who kept their child during school, and they're you know they were single, and we highlight them for the fact that they were successful as a single parent, and as someone who kept their child and was able to go against all odds, as it were, and still thrive. And there's this dichotomy there that I find. Before we get into how you started to leave the abortion practice, some of the changes that happened in your mind, and some of the questions that you started to have, we'd like to touch a little bit on the abortion procedures themselves. And the reason we want to do that is because as pro-lifers, we know that abortion is wrong. We're against abortion. We speak out against it. But in my experience, many pro-lifers don't actually know what abortion is, the individual, the specific types of procedures that are available to women. So from your experience, could you share with us some of the different types of abortions that people can get at different stages of pregnancy, and just outline them for us? Share, what takes place during those procedures, what is required on the end of the abortion provider, and just what each different abortion procedure looks like.
Okay. So in the first trimester, the first third of pregnancy, normally the surgical procedure that's done is called an aspiration, or D&C with suction abortion. And in that case, the woman is given some local anesthetic in her cervix, and a plastic tube is inserted into the uterus, and it's attached to suction, and the abortionist suctions out everything in the uterus. And the further along the pregnancy, the more the abortionist can actually see. You can tell as the fluid comes through, and then when the baby comes through, and then when the placenta comes through, because of the different, you can see what's in the tube. As the baby is pulled through the hole in the tip of the suction, the baby's is bigger than the hole, but it's soft, and so it gets basically macerated as it's going through the tube. Now, you still can see the little body parts, and the abortionist has to go through those parts and basically put the baby back together after a certain gestation, once the fetus is big enough to see. You have to put those little parts back together to make sure nothing was left inside the uterus to cause infection. I actually think that's why most OBGYNs don't do abortions. You can't paw through baby body parts for very long and not have it affect you, not have it affect the normal person. So the procedure, the other procedure that I learned, is done in the second trimester, and that's called a D&E, or dilation and evacuation, or dismemberment abortion is the lay term often used. In that procedure, we also use a suction cannula to pull out the fluid. It also will pull the baby down lower into the uterus. Prior to that procedure, depending on how far along the pregnancy is, we normally have to dilate the cervix, and this takes either 1 or 2 days. And we insert pieces of seaweed or other types of dilators that expand with fluid. And so it opens the cervix big enough that we can get in with our instruments and dismember the baby. So 1 to 2 days of enlarging the cervix. Woman comes in, we pull those out. Oftentimes, for these abortions, people get general anesthesia, but sometimes not, just the cervical local, or we call it a paracervical block. I want to say, by the way, that abortions are painful. And I used to work so hard to try to make them as painless as I could for the patient. I never even thought about the pain the baby might be having, which is crazy. But anyway, going back to dismemberment abortions. Once the laminaria are out and we've suctioned the fluid, we reach in with some real heavy duty clamps and we just grab whatever we can. And if you pull and kind of twist, you can twist off that body part because the rest of the body is stopped by the cervix. And then you just keep doing that until you've got all the arms and legs, and then you have to try to reach in and you have to open the clamps bigger so you can try to grab the head. We try to grab the head first because it's difficult if you just have this little sphere in there running around. It's harder to get that later. So try to get the head first. You crush it. You can tell when you've gotten it because this white stuff oozes out, which is actually the brains. Then you try to go in and crush the thorax and pull that out. Then you try to grab the placenta, pull the placenta out, and then I always put the suction cannula back in to see if there was anything else in there. And then I would take a large metal curette and just carefully just feel the sides of the uterus to see if there was anything else in there. And then you do have to go and put the baby back together before you let the woman get up and make sure all the body parts are there. And as the baby matures, you start to get some calcification. So it's important that you don't leave bits of skull inside the uterus. As a matter of fact, I had a woman come to me after an abortion with bleeding. And when I did a hysteroscopy to try to find out why she was having bleeding, I found pieces of skull bone still in her uterus, which I removed. So then we would, if everything, we have all the pieces, then we let the woman get up. So as the pregnancy progresses and more calcification occurs in the bones, it becomes more dangerous to try and do a dismemberment abortion. And this is when the intact DNX, this is when the intact D&E was developed, otherwise known as DNX, otherwise known as partial birth abortion. And in that case, they really overdilated the cervix and I never did one of these, then they would try to manipulate the baby into a position where it was feet first, and then they would pull down on the feet and deliver the baby as far as the head. And the head would be too big to come out, so then they would insert a scissors in the back of the neck at the base of the skull, open the scissors, and the brains would come out, the head would decompress, and then they would be able to completely deliver the baby. In China, they do something similar. If the baby is head first, they would just puncture the fontanelle, suck out the brains, and then deliver the baby. Another procedure that can be done later in pregnancy is called an induction abortion. And that's where it's like it sounds. You induce labor and just deliver the baby. Now, in these cases, if you don't give something to kill the baby ahead of time, you will have a live baby. And I actually have a cousin who survived an induction abortion. She's Canadian.
Wow.
There are there are actually quite a few people who have survived abortions, all kinds of abortions, D&Es, D&C with suction, induction abortions, even one guy who said he survived a partial birth abortion. So then there's one other type. Well, there are some older types that aren't done anymore, like prostaglandin abortions and saline abortions or urea abortions. Those pretty much aren't done. They even used to do a hysterotomy, which is almost like a C-section. They'd make an incision in the uterus, pull the baby out, and I guess they just cut the cord and let the baby die, bleed to death. That's pretty much not done. But one thing that is commonly done that's available now is the abortion pill abortion. And more and more abortions are being done that way. And basically what happens is you take medication that causes a miscarriage. I remember being sort of horrified when I heard about RU486 and that people were going to be taking this medication and it was going to be causing miscarriages, because as an OBGYN, miscarriages was one of my emergencies. One of the things, I put the pedal to the metal and, just went all out trying to get to the hospital, because these women would sometimes bleed to death. And I think it's crazy that we're creating all of these miscarriages, creating the kind of pain and misery and complications that you get from these abortions. They are more dangerous than surgical abortions. And the way it was depicted on the movie Unplanned is not an exaggeration of what women go through. They're very traumatic.
Mm-hmm. And again, Dr. Aultman, thank you very, very much for being willing to share this with us. It breaks my heart even just to hear about these procedures, knowing that there are children each day in Canada and America and around the world who are suffering death in this particular way. And Peter and I can definitely relate to when we're doing our pro-life outreach, and we're showing abortion victims, photographs of abortion victims, and often we're met with this incredulity of, there's no way that it could look like that. There's no way that we would allow a procedure that would look like that. And we often, whether we share a testimony from yourself or somebody like Dr. Anthony Levantino, and just show, no, this is exactly how abortion providers describe it. I know there's even abortion facilities that will have a not as accurate description of these procedures, but some kind of a description of them. This is something that you have testified to in court, speaking with politicians and speaking within the greater movement. And I'm curious what the response has been when you, as somebody who has personally performed the suction abortion and the D&E abortions, when you share the reality of how these abortions are performed upon these tiny human beings, what has the response been that you've witnessed, whether it's from politicians or from courthouses or even just from the general public in the beautiful pro-life ministry that you're doing now to save lives? What has the response been when somebody with your expertise can clearly and succinctly describe these procedures as you have here?
Well, I have to say, in the political arena, I don't know how much difference it makes. They pretty much have already made up their opinion before they come in. I don't think they hear me. And same thing for the people, from pro-abortion people on the other side. Now, I'm always glad when I see a whole bunch of young girls in pink shirts come in, because I keep hoping that maybe something I'm saying will get through to them, but I don't know that it does. This whole issue blinds people so completely. It blinded me. I didn't see it. I really didn't. God had to open my eyes. So in the political arena, I don't know that it changes. I gave a talk at church, and it was amazing how many people came up to me afterwards and said, and then these are Christians, I was pro-choice, but after listening to your testimony, I've changed my mind. You said it differently. And I think it all depends on how set people are in their ways. if they're really set in their ways, it doesn't make a lot of difference. Although when I talk to my friends that created Equal, it does seem to change people's opinion once they really see it in not black and white, in full color. When they see it, it does seem to change their mind, because most people have no idea. We tend to shut out things that we don't like and don't want to know about, and most people do that with abortion. They they like the idea that they want to be pro-woman, they want to help women. They just don't want to know what really happens in order to make that occur.
Mm-hmm. And Peter, I'm sure that one thing that you've seen while doing activism with abortion victim photography, people have such a hard time embracing and accepting the abortion victim images, and that's why at many of our displays we have ultrasound images as well, to kind of juxtapose abortion with the naturally developing human beings, and people will embrace wholeheartedly. Oh yeah, that's absolutely what I expect an 8-week-old or an 8-month-old child to look like inside the womb via ultrasound imagery. And so what I'll often do is simply, I don't convey it anywhere near as eloquently or descriptively as you do, Dr. Aultman, but kind of describe the abortion procedures and say, okay, if you agree that that's what a child would look like before an abortion, when you understand what these procedures do, what do you think they would look like afterwards? And isn't that very similar to what these abortion victims look like in these photographs? We're going to have Greg Cunningham on in one of our upcoming episodes talking about kind of the legal side of abortion victim photography and that sort of thing. But I'm curious, Peter, if you've had a similar experience. I just think of that, trying to get people to think of what would an abortion victim look like after an abortion, um, and with that, I wonder what the conversations you say that many OBGYNs don't perform abortions. I've heard statistics through the years that very few people end up performing abortions for a long period of time. Many people end up walking away from performing abortions after several years. And I wonder if that's something that you witnessed while working in the abortion industry. Obviously, yourself, praise God, are no longer performing abortions. I wonder if that's a theme that you saw, Dr. Aultman, while working in the abortion industry, seeing people walk away for various reasons after having been part of it.
Well, I wasn't inside for very long. I
Mm.
basically was doing it during my, residency program. What I didn't know was one of my fellow residents, who later I ended up being partners with. I didn't realize that he had also stopped during our residency program. He basically said God told him it was evil.
Mm.
Um, I think what happens to most people is, I think they stop after their residency program or shortly into their practice, because here they are, they're delivering babies, they've got all these pregnant moms in the office, and it's pretty hard to justify taking care of all these moms and their babies, and then in the other room doing abortions. There's just too much of a contradiction. And also, there are a lot of pregnant women who do not want to be going to somebody who does abortions, and they can lose patients. I
Mm.
will tell you that um, it made a difference to me when I still believed in abortion. I wasn't doing them myself, but I still believed in abortion. It made a difference to me when my patient asked me, "Do you believe in abortion?" And when I said yes, she said, "Well, I'm going to have to find someone else to see for my pregnancy." I had seen her for several years since she was a kid, for GYN, and that really spoke to me when she said that. It made me think about it, and was one of the things in my transition away from doing abortion. So you may make a difference if if a woman stands her ground and says, "Hey, if you're doing abortions, I'm sorry, I can't see you, because I feel so strongly about this." And if that person has enough people say that, it might make a difference in them walking away.
So, Dr. Aultman, you mentioned a little earlier that you weren't just pro-choice, you were pro-abortion, you were performing abortions, you thought this was what you needed to do to help women. But then you also mentioned that God brought you out of this and turned your mind from being pro-abortion. Could you share with us how this happened? How did you go from performing abortions to recognizing the injustice of the abortion procedure itself?
So I continued doing abortions while I was pregnant because I felt like my baby was wanted, theirs wasn't. And so it was okay. But after my baby was delivered, I went back to do abortions at about 6 weeks postpartum. And I think something had already happened in my mind because of my own delivery, but there were 3 patients I saw that day that changed my mind. The first young girl, I realized looking at her chart, I had done 3 previous abortions on her myself, and I hadn't been doing abortions that long. And I went to the clinic manager and I said, I don't want to do this. I've already done 3 on her. She's using this as birth control. And she said, you don't have that right. She has the right to have abortion, and you have to do it. So dummy does it. And sure enough, I tried to talk to her about contraception, and she had absolutely no interest. She liked using abortion as her contraceptive method. The second patient came in with a friend, and sometimes people would ask me to see the tissue after the abortion, not very often, but occasionally they did, and I would show them. And after I did the abortion, her friend said to her, do you want to see the tissue? And she said, no, I just want to kill it. And I thought, what did this baby ever do to you? It wasn't the baby's fault. And it just, her reaction horrified me. Her hostility horrified me. And then the third patient, I think, was my last patient. And she already had 3 or 4 kids at home. I think she had 4 kids. Maybe this was her 4th pregnancy. She and her husband felt they couldn't afford to have another baby. And so they had decided she should have an abortion. Well, she cried the entire time she was in the clinic. And after that, the fact that the baby was unwanted was not enough of a reason for me to have to kill it. And that's when I stopped physically doing abortions. Now, it wasn't until a couple of years later that my mind was completely changed. Part of it was, seeing women in my practice with unplanned pregnancies that kept them, young girls kept them, did great. These other women who were having psychological and physical complications after abortion. So that got rid of this, whole idea that, well, abortion is the best thing. At my church, I saw a couple of young women keep their babies. One of them actually was a Down syndrome baby. And as I watched them grow up, I thought, oh my goodness, these children wouldn't be here. These precious little kids that I ended up teaching in class, they wouldn't be here if their mothers had made the other choice. So that was a biggie. The final thing was, now I still believed in abortion even after I became a Christian. I was raised as a preacher's kid, but when in college I became an atheist. Finally, God got me by the scruff of the neck and found me and brought me back. And I became a Christian, but I still believed that a woman has the right to have an abortion. It wasn't until I became involved in a singles ministry and a friend there finally got up the courage to say, Kathi, I know you feel strongly about abortion, but would you read this article? And I said, okay, because it was someone I trusted. And it was an article that compared abortion to the Holocaust. Now, I can't talk about this when I testify because it's politically incorrect, but I can't help if it's my story.
Yeah.
So my dad was with the unit that opened the first concentration camp liberated the first concentration camp during World War II. So I grew up with these horrible pictures from the camp that he'd taken and the stories, so that this was very meaningful for me. And when I became a doctor, I could never understand how the German doctors did what they did. Well, in reading that article, I realized, well, they could do what they did for the same reason I could do what I was doing. And that is that we didn't consider them human beings. And if you don't consider a group of people as human, you can justify whatever. You can compartmentalize. And that's exactly what I had done. And that was the first time that I realized that I was a mass murderer. And it was at the same time when Ted Bundy had been arrested. And I thought, oh my gosh, here this guy's going to be put to death. And I've murdered a lot more people than he ever did. And it took a lot of counseling and a lot of prayer for me to be able to get over having had an abortion and doing abortions. And I think once I had my own, my child that I did deliver, it made me really sorrowful about the baby that I had aborted. And I think often that happens after you've had a baby and you see what it is, then you think back and think, oh my gosh, who would that little person have been? And I wonder, as a country, we've killed over 60 million in the United States since Roe v. Wade. How many Einsteins and philosophers and, doctors, great artists have we killed and deprived our society of their being and deprived them of ever being able to have a life. There's no other circumstance in which we allow one person to kill another person for their own convenience or to make their life better. I can't think of any other circumstance, except I think we're moving that way with assisted suicide. We may be kind of pushing older people to commit suicide or begin to think, oh, well, they're so bad off, it'd be better for them if we get rid of them. Well, really, it's better for us sometimes to not have to take care of them. So I think we're seeing it at both ends, the same philosophy.
And I'm glad that you mentioned it that way, because that's so often how our conversations go when we're talking to people on street corners and on doorsteps. When else do we kill innocent human beings to solve problems? And even the most challenging, even the most difficult of problems, when is it okay to kill an innocent human being to solve that problem? And praise God that he was able to open your eyes, and now you're working so diligently to defend these weak and vulnerable members of the human family, to educate the public, to educate everyone about the reality of what abortion does to a preborn child and the humanity of those children. I think that it's beautiful the way the Lord is using you to share your story and to really open people's eyes to the injustice, the horror of abortion, and helping to turn those people away. Because those three stories I find so powerful. Those three women that you encountered in the operating room, the one woman who just didn't even think about it. It wasn't a matter of, I don't want to do this, but I feel like it's my only option. This was somebody who, yeah, like you said, was kind of flippant about the abortion decision. This was just a form of birth control. We've met people on street corners who have had a very, very similar mentality of, it's just simpler this way, or for whatever reason, she's decided that that's the easiest thing for them. And just being able to share your testimony to to help people realize that this isn't the right way to respond to different circumstances. That this is a human being who deserves human rights, just like you and I, regardless of the fact that they're younger and less developed. And the last thing that I know that I'm babbling a little bit here, but just so much of what you said is so beautiful and so powerful. I mean, at CCBR, we used to do the project called the Genocide Awareness Project, where we tried to open people's eyes with the reality that the abortion situation in North America is in many ways comparable to those other historic genocides. I know that obviously every genocide is different amongst themselves, but when you think of the dehumanizing and the systematic killing of a defined group of people, I think that that's a powerful thought for people to ruminate on, that this is something that is happening with the permission of our politicians. It's happening with the permission of the media and of culture, and at times with the church. And I think that it's beautiful to think about um, how we can start turning the tables on that, and how we can continue to provoke people with that comparison to really shock them out of their acceptance of abortion in society as just something that happens and we don't need to think twice about it. Okay, look at all of the parallels with these historic injustices. I think that's such a powerful um, connection that can really benefit a lot of people in kind of jolting them out of the worldview that they're in. Peter, I don't know if you had any other questions that you wanted to ask before we kind of dive into where we're going from here and what's happening with the Charlotte Loge Institute.
Yeah, no, I would love to ask that. So, Dr. Altman, you recognized, you turned from being pro-abortion to recognizing the murder of these young children. But there's a difference between becoming pro-life or becoming anti-abortion and speaking out against it. And you've spoken out against abortion, in court hearings and congressional sessions and different places. Could you share with us your journey to being a public advocate against abortion, a public witness and testament to what abortion really is?
I have to tell you, it was my worst nightmare. It was the thing that I absolutely did not want to do. The last thing I wanted to do was think about abortion at all. But I think after healing emotionally, God just started working on me, and I finally said, okay, I'm open to doing what you want me to do. And I got an email right after that. After I was willing, I got an email asking I got an email asking for people who would be willing to go to Washington and testify on partial birth abortion. It's interesting. Even when I was doing abortions, I thought, oh my gosh, I can't believe they're doing DNXs. That's murder. I don't understand why they're not being arrested. So I answered the email. It turned out that it didn't work out for me to go, but after that, I ended up testifying in Florida and a whole bunch of other states, and then eventually before Congress and in court defending abortion bills all over the United States. It was always very difficult, and I basically always made God prove to me that he wanted me to do that particular thing. And actually, the last thing I did, I said, God, I do not want to do this. You're going to have to be really, really clear with me because I don't want to go. And he did. He gave me scripture after scripture after scripture. And the final straw was I went to church and standing in front of me was a woman with a really, really preemie baby, the same age that they would be doing a partial birth abortion on. And I just started weeping and I couldn't stop. And I said, okay, all right, I got it. I'll go. And then everything sort of died down. I will say that I got very discouraged because it seemed like every time I did something, nothing came of it. Everything was overturned. and I got very discouraged, and things kind of dried up. They weren't asking me to go anywhere. And then all of a sudden I saw where it had passed. The ban had passed. And so don't give up. um, but then I kind of went back to my normal life, ended up getting married, and went back to my, just doing my practice, which I had never left. And then I ended up in 2014, I had to retire because I became allergic to everything I was using, my mask, gloves, patients, everything, and ended up being in my house for about a year and a half, not being able to go out. And I remember praying, Lord, please let me still do something important, because I had initially thought I would be a missionary in Africa after I retired. I'd always wanted to do that. And I thought, can't do that anymore. And about a week after I prayed that prayer, I got a call from a woman who'd been trying to reach me and wanted me to go testify before Congress. I think it was on heartbeat bill. And I went, and it was after that I was approached by Charlotte Lozier Institute. Would I be an associate scholar? Which I kept telling them no for about 6 months, and then finally agreed. And just went gangbusters. I realized when I went to do my taxes, I was flying somewhere every 2 weeks, testifying somewhere. Then when COVID hit, couldn't travel anymore, but God opened up writing opportunities. So I've been doing a lot of writing since then, and video conferencing and podcasts and things like that. So God has kept me busy. I did tell him after I prayed that he would allow me to do something important. I told him, and when he showed me, I told him, I said, okay, I am not going to make you prove to me with each offer that I should accept. If you don't want me to do something, then you tell me you don't want me to do it. Otherwise, I'm going to accept everything that comes along. And that was pretty scary. And yet, the 2 times that I really felt uncomfortable about doing something, I said yes, but then God worked it so I didn't have to do it. So that really built my faith that I could depend on him to protect me and take care of me. And what I would tell people is, you don't have to figure it all out before you start. If you see a little opportunity, move forwards. I think God can direct you better if you're moving than if you're staying still. And just have faith that God can direct you, and that if you start going the wrong way or making a mistake, he can get you back on the right path. So just start something little. Just do what's right in front of you.
Mm-hmm. And yeah, amen. Praise God for the way that He is using you now. I think often of the quote that I find too many Christians hold on to of, we're not called to do great things, but small things with great love. I often think of, we're called to do whatever God asks us to do, regardless of great or small. Sometimes the things He puts in front of us appear small at the time and end up becoming monumental, and sometimes vice versa. And I'm just so thankful that you have been able to answer the call and be such a beautiful witness to this important cause right now of protecting the lives of preborn children. So thank you very, very much for your courage and your eloquence, Dr. Aultman.
I think, I actually like that quote, but the thing is, you never know how big it's going to get.
Yeah.
I was so impressed when I was at the Rose Dinner that there were all of this myriad of ministries. It was almost like a diamond with multiple facets, all made up from just small individuals who felt God leading them to just open their home to a pregnant woman, or they all just started doing a little tiny thing, but then God blossomed it. So you just start where you are, and then God will take you where you need to be. I was asked to speak to at the Rose dinner and the March for Life in Washington, which totally floored me. I didn't even know what it was, and I really had not had much experience speaking to large groups other than testifying, and I certainly not speaking at a dinner. That year, right before then, I got a call from a woman who wanted me to come out and speak at their March for Life in Utah. So thankfully, I had experience there. And then another woman called me and asked if I would speak for Brazil for Life at a dinner. And so I got experience at a dinner. So that was my only experience when I was suddenly asked to speak in Washington. So it's crazy what God will do.
Yeah, no kidding. That's definitely right. Now, it's very, very clear that you have a lot of interaction with pro-lifers now. Before we wrap up, I would like to ask, did you have interactions with pro-lifers while you were performing abortions or while you were in supportive of abortion even? And what was the image that you had about the message that they were bringing? Did you look at their message and say, or our message, and say, yep, that's accurate, but I disagree? Or did you look at that message and say, you know, what are they even doing? They're not supporting a woman's right. How did you interact with pro-lifers prior to leaving the field of abortion?
I didn't really directly know any people that were pro-life, and I thought they were all crazy, radical, rabid lunatics. I thought they were the worst people in the world, but I didn't really know any of them. I just saw what was portrayed on television, and I thought they were horrible people, and I was so amazed to find out that these people were actually some of the most loving, caring people I have ever met, and who care about women, probably more so than than the other people. I really was shocked to find that, and I don't see the people that are the rabid, crazy lunatics. But that's what I thought of them.
I have one more question as we wrap up, Dr. Aultman. Looking back, if you could go back in time and speak to your 20-year-old self, who is thinking more and more about becoming an abortionist or in the situation where you were pregnant and thinking about getting an abortion, looking back on yourself back then, what would you say now, knowing what you know?
I I would try to empower that young woman and say, um, you can do this. This is not your only choice. You have options, and this is a choice you are not going to be able to reverse. And something, you're gonna have to live with this the rest of your life. And I would be honest that, you know, I would say, do you really want to kill your baby? Do you really want to kill your child? And um, I would just talk about the fact that, I could, if I really wanted to go to medical school in the fall and didn't want to have a baby right then, why not give that baby the option of life and let that baby be adopted? Um, if And then on the other hand, I would have had, you have support. You could have the baby and then go to medical school later after the baby's in school. Which, I met many women like that, and I think I would have tried to introduce myself to one of these ladies, or that girl back then. I would have tried to introduce her to someone who had done that. It's funny, the day before yesterday, I sort of felt the Lord speaking to my heart that now that President Biden has been elected and he is going to try and reverse every pro-life thing that President Trump did, who was the most pro-life president we have ever had. I thought, what we need to be doing is changing the culture so it doesn't matter what the government does. We need to be putting out programs that um, um, lift up, elevate motherhood, fatherhood. We need to quit emasculating our men so they want to be fathers. Um, put stories on television about successes, like you were talking about, successes of these young mothers having babies and still being able to pursue their dreams. That's why we all became so convinced that abortion was so important, was because that's what we saw in the media all the time, all the movies. Looking back at old movies, I'm amazed at how many times here's this poor woman, she gets pregnant, she gets a back alley abortion, she dies, or that was just always the sob stories about these young women. So we need to change our media, and our churches need to talk about abortion, because it's the young Christian girls who are actually more likely to get an abortion because they don't want their families and their friends to find out because they're Christian. They need to know that they will still be accepted no matter what, and embraced and helped, and that they have this whole group of people who will be willing to help them. So our churches need to be places that someone could run to, not run away from. And we need to have programs that can help young mothers if they want to keep their babies, help them with the things that they need. Actually, one of the neatest things I heard when I was testifying one time, there was a church that developed a program where they would, their members volunteered to take children temporarily from people who were, say a mother was a drug addict and she needed to go into therapy for a while. She could go to this church. They would give her a number of families that might be available to take her child. She could pick the family. The family could decide if they wanted the child, and they tried to pick a family in the same school district. And that family would temporarily take care of that mother's children until she could come back. Or maybe she just had a health issue. Maybe she was just overwhelmed. Rather than those children being put into permanent foster care where it's really hard to get them back, they could stay with the church family. They could see their kids whenever they wanted to. And then when they were ready, they could have their children back. And I thought, what a glorious program, and that's the kind of thing I think churches need to be doing, and be resources so that, as Jeannie Mancini from March for Life says, we make abortion unthinkable. We don't have to legislate it because it's unthinkable. We wouldn't do it. And that's where we need to move, I think.
Yeah, I completely agree. We need to make abortion unthinkable. We need to reach the culture with the truth about abortion so that the politicians feel pressure from the pro-life side, feel pressure from the side that's against abortion, and in turn follow their lead. Dr. Aultman, thank you so much for taking the time and joining us. It was a great pleasure. As a difficult conversation that you shared, a difficult, the reality of what abortion is, but we thank you so much for taking the time to join us today.
You're welcome. It's been a real pleasure, and I'm just excited about what you guys are doing. Just a little bit I've heard today, and I just pray that God blesses this ministry.
Wonderful. Thank you very much. All right, everyone. That was Dr. Kathi Aultman, former abortion provider, but now is working full-time. Well, maybe not full-time, but certainly traveling all over the place, meeting with people, testifying to the reality of abortion wherever she gets the opportunity. And so we are so thankful for her witness in the movement, her witness sharing the real truth about what abortion is. Thank you so much for listening, everyone. If you want to hear more content like this, check us out on your podcast catcher or on our website, prolifeguys.com. If you want to financially partner with us as we bring more content to you, as we work on more projects that we have, as we equip people to have good, life-changing, and effective and winsome conversations on abortion, do financially partner with us. You can do that at patreon.com/prolifeguys. You can become a patron and get some pretty cool merch, if I do say so myself. Some of it is exclusive to Patreon. So go check us out, patreon.com/prolifeguys.
Yeah, one quick pump on that as well. I'm going to give a special shout out even to our $5 a month gig. I know a lot of people who are listening are college and university students. We got high school students. We got people who are early in their career. We super appreciate you guys tuning in. If where you're at in life, $5 a month is where you're at in your ability to financially partner, this is going to allow us to continue having on guests like Dr. Kathi Aultman, like putting out more and more video content as well. Maddie, our incredible producer who is editing all of the stuff behind the scenes, recently had to update his computer to be able to crush through all the video content that we're putting out now, and that's only going to increase. And so that's what the money is going towards. And even at $5 a month, you get a pretty sweet laptop or bumper sticker, Pro Life Guys bumper sticker. You also get into our annual kind of open house meeting where Peter and I share about how things are going for the Pro Life Guys. You can ask your questions and you get some bonus content as well. We mentioned a few weeks ago, we've got an episode coming out soon. In which me and Peter and Jonathan, I'm sure that I should have said Jonathan, Peter, and I, talk about our favorite books and whatnot. There's other content, stories from within the pro-life movement that are Patreon exclusives. We've got some rants and rambles that we're going to be publishing on there as well. If you want to get exclusive content of this show and what's going on inside my head and inside Peter's head, please do check that out. And if you want to be part of our annual kind of open house meeting each year and get a pretty sweet bumper sticker, $5 a month will really help us to grow as a podcast, getting on even cooler guests and continue pumping out sweet video content.
All right, everyone. Thank you so much for tuning in. Go follow us on the social media, wherever you do your social media. And we hope you tune in again next week. Take care, everyone.